Hello, I am Dr. Pembroke. Today we are going to learn about the disease heart failure. Let's start with the heart. This is the heart. It is a vital organ that keeps us alive. It has 4 chambers, the left and right atrium and the left and right ventricles. A normal heart has highly organized contractions of the 4 chambers to function properly through the electrical conduction system of the heart. The contractions of the heart pumps blood continuously through the body to provide oxygen and nutrition needs. Heart failure occurs when the heart cannot keep up with its workload and fails to give enough oxygen for the body, therefore not supplying the cells with enough blood and not pumping as well as it should. Let's see some of the signs and symptoms of heart failure. Most common causes of heart failure are coronary heart disease and hypertension. Signs and symptoms may be similar to other cardiovascular and related diseases. Clinical diagnosis is often unreliable with obese patients, patients with pulmonary disease, and the elderly. Some physical signs typically occur later when heart failure has advanced. There is a lack of universal agreed definition of heart failure. Therefore, diagnosis can be difficult, particularly when the condition is mild and patients can be asymptomatic. The most common measurement of heart failure severity is based on the New York Heart Association grading. This is a system used by the Australian Heart Foundation. As it is hard to diagnose heart failure, anyone who is suspected of having heart failure should be examined and investigated by undergoing ECG, chest X-ray, and echocardiogram. As heart failure can be asymptomatic, it can be hard to diagnose. Many people are unaware that they have heart failure, therefore data on the epidemiology of heart failure in Australia could be underestimated. However, estimates can be made through larger scale of studies undertaken in the US and Europe. From the Australian Heart Foundation Guideline of Chronic Heart Failure 2011, it is estimated that overall chronic heart failure occurs in 1.5 to 2% of Australians. In normal contraction, blood comes in the vena cava into the right atrium and then the right ventricle, then out the pulmonary artery and into the lungs. Oxygen-rich blood returns through the pulmonary veins and into the left atrium and the left ventricle, then exit the aorta and through the systemic circuit, providing the body with oxygen and nutrients. Ejection fraction is a measurement of the heart's pumping ability and can be used to identify heart failure. The left ventricle is most of the heart's pumping power. Diastolic heart failure occurs when left ventricle loses its ability to relax and stiffens. Less blood fills in the muscle and less blood is ejected. As compensation, the heart will try to enlarge and develop more muscle mass to pump more blood initially, but eventually lead to muscle hypertrophy and stiffer muscles. These signs and symptoms can be due to other diseases or are signs and symptoms of other diseases. As these symptoms are similar, there are data suggesting that diastolic heart failure is a progression from asymptomatic hypertension heart diseases. Systolic heart failure occurs when the left ventricle cannot contract adequately, even if the ventricle is fully filled. Therefore, less blood is pumped into the circulation and lower ejection fraction is seen. Right-sided heart failure often occurs as a result of left side failure. Fluid pressure increases when left ventricle fails. Therefore, blood transfer back through the lungs and backflow against the valves and damage the right side. There are currently no cure for heart failure, but effective management can be made to improve the quality of lives and prolong the lives of heart failure patients.